What I found super helpful in supporting my son's journey was the family education program. It was offered through our early psychosis intervention group at our local public health unit. I learned some methods for better communicating with my son, and it was a game changer. I think all of us, including my son, were always wondering when everything would go back to normal. When it seemed like it did, my son went back to school and he went back to work. And then one day he forgot to take his antipsychotic medicine, and his one day turned into many days and months. And then he met a new person who didn't believe in psychosis or medicine, but did believe in weed. And you can probably imagine how that ended. He ended up back in hospital.
Each of my children had a unique journey. My younger child has followed the doctor's recommendations, has been medication compliant, and has managed to rebuild their life. My older child has had more of a rough time of it because they questioned their diagnosis and certainly questioned whether they needed their medication. When they chose to stop their medication, they did experience a relapse. That was the turning point for them, that they really needed to continue their medication and to really lean into the treatment. The level of care that each of them needs is different because they are different people. My younger child is still in epi services. They haven't completed the full amount of time necessary for that. My older child is now with a different team. They graduated from Slaight and they were handed off. It was a warm handoff, so it was a really great transition. The new team was very well briefed so that they could provide appropriate care for my older child, who does have concurrent issues and needs ongoing support.
My role as caregiver, I'm going to be honest with you, I think I was a bit of a drill sergeant. I was on him a lot, on my son a lot. Did you take your medicine? Did you eat? Have you been exercising? It seemed important to keep things stable and balanced. So that's kind of what my role was. And staying connected to care was absolutely critical. I don't know how anybody gets through the first psychotic episode without care and without the guidance and support of that early psychosis intervention team.
My role as a caregiver during their journey was to support them as best that I could. During the crisis phase, I would say I went into survival mode. But I also realized that I needed to have my own self-care. And I have worked very hard at that. And as they got better, that component has grown, and I continue that to this day so that I can be there for them when and if they need me.